Hey guys, so I bought this fanny pack and I got it off AliExpress for like $5 or $6. I wanted to do a review on it, but AliExpress doesn't take video, they only take pictures. So I'm gonna show you exactly how great this fanny pack is and what you can use with it for emergencies, like protesting. So this is about 13 inches from side to side, from end to end, here to here. And it is about 7 inches. Well, okay, hold on. It's 5 inches this way. And from top to bottom about 5 to 4 inches. Okay. So this fanny pack, you can get any fanny pack, but this one was $6. So, and I'm gonna show you what my emergency kit consists of. Okay. So I have my CPR mask because I guess I have herpes, whatever. Anyway, but that's not why I got this. Like, I got this during a CPR course. Basically, you're supposed to have one because the patient might have herpes, or you might have herpes, whether you know it or not. And it's just good to use when you're gonna do mouth-to-mouth and resuscitated breaths. So, put that in there. I got flushable wipes for just cleaning myself or others, I guess. I don't know. Just flushable wipes. Saline wound wash. This is gonna be great for pepper spray. It is, I'm not gonna spray it because I don't want to waste any of it, but this will be great for putting into eyes. Saline, normal saline, it's like salt water. It's kind of like the composition of your tears, to make it easy to understand. Yes, so this is gonna be really helpful in case anyone gets pepper sprayed by ice. So yeah. Disposable gloves, I got this for like $1 or $2. Technically like $1.53 or something like that off Walmart. It's 10 gloves, puncture free. They're not sterile, but like, you know what I mean? Like, when you're gonna be, if you're dealing with blood, you need to put on gloves. You can't be exposed to blood just barehanded. So any kind of barrier will be helpful. This is 10 gloves. $2, less than $2, Walmart. Put that in there. This, you're not going to be able to find this unless you somehow go to the hospital and ask them for a normal saline injection, right? So this is baby shampoo that I put into a normal saline thing that I had from years ago. It expired in 2020. So I had no use for the normal saline that was already in here. This was for normal saline, sodium chloride. But I just got rid of the normal saline, the sodium chloride stuff in here, which is, again, stuff like your tears, right? This is what they use to hydrate you. And I got rid of it. I filled it up with baby tear-free baby shampoo. Now, tear-free baby shampoo also helps with pepper spray. Okay? That's what they say on the internet, at least. There's no, like, clear-cut way to get rid of pepper spray from your eyes. But this and a bottle of water, just like a little bit, like maybe like this much, a couple drops is all you need. A baby shampoo. I just put it in here because I don't have a lot of space. Well, I have space, but I don't want to like get like too bulky of like a thing. Like, I was gonna use this, like a mouthwash thing from the hospital. But this is a little bit too bulky, but we'll see if we can fit this in. If we can fit that in, I'll be really impressed. Because I haven't tried that yet. Okay, so I'm going to put this in here. Antiseptic towelettes, which are what you use to clean the wound. Gauze, which is after cleaning the, actually, I'll start with Neosporin. Neosporin also cleans the wound, but make sure it's an antibiotic, first aid antibiotic, and it has pain relieving properties in it. So this makes sure that the wound doesn't get infected. This is really important. Clean it. So clean, antibiotic, make sure that it doesn't get infected, and then you put gauze. Gauze, which is a dressing. It's like, I don't want to get rid of it, but it's basically like, you know when you go to get your blood drawn and they put like that little, whatchamacallit, like that little dressing, that fabric cloth thing, and they fold it up into like two, and then they put it on, and then they put a piece of tape over where they took the blood from you. This is what that is. So I have 2x2, and I had 2x2, 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 and a 3x3. Two 3x3s. Hopefully nobody will need these, but with ice being the way that they are, you just never know how people are going to get hurt. So I'm going to put this gauze inside of here. And once again, Neosporin pain relief ointment. I tried looking for a spray, but they don't have a spray. They have an ointment, and I think they have like a lotion type thing. I don't remember, but I got the ointment. Fabric bandages. You don't want the regular bandages. Make sure you get fabric because they will stick on a little bit better. They're just, you know the differences between band-aids. You know the band-aids that come off really easily, and then the band-aids that are a little bit like more canvas-like, and they stay on your skin actually and are a little bit more flexible. These are what they are. So I have 4 of these. I have the knuckle ones, also fabric. I have 4 of them. More band-aids. This is from when I was in nursing school. They gave me this at Holy Cross. I have about like maybe 6 or 5 band-aids in here. I can just pull a band-aid out. I just thought it was really convenient to have, so I'm putting that in there. These are safety shears or scissors. These have a certain end to them. So if someone is passed out, for example, and you want to cut their clothes off so you could do chest compressions or see if they got hurt anywhere on their chest, this will make sure that they don't get punctured or cut. Because, you know, normally it's sharp here, and when you're digging to cut their clothes, you don't want to hurt them more than they already are. So these are a little blunted at the end, but they still cut properly. If you're gonna get these, I don't think you really need these. You need scissors, though. You do need scissors. In case you have gauze and you need to cut the tape, you don't have time to like try to rip it with your hands, and you have gloves, you're dealing with blood, it's better to just cut and then tape it on. So either a normal pair of scissors, or if you can afford it, safety shears. They have smaller ones in this. I would recommend getting the smaller ones. These are what I just got from nursing school. I didn't think that I would need a smaller one, but this is what I have. So I'm going to put that in here. Tape. Doesn't matter what kind of tape. You can use duct tape. You can, any kind of tape. Maybe not duct tape. I think that'll hurt when you take it off, but you know what I mean? Like, I think they'll be able to survive with any kind of tape. I'm not a nurse. But I went to nursing school, so. All 4 semesters. Almost passed, but didn't. Anyway. This is a safety kit that I got from 7-Eleven like a long time ago. I'm just using the little package because I like it. Little tool thing. I think it's a knife. I think this is a nail file. Bottle opener. Maybe the knife will be useful. Pins, in case you do cut someone's clothes and they get taken to the hospital, you can pin up their clothes, is what I'm assuming this is for, just in case, just to keep their modesty in mind, just to be mindful. Tweezers, you never know. Yeah. Burn gel, you never know. Alcohol antiseptic pad. Yeah, alcohol, if I'm not mistaken, will hurt. It'll sting. But it'll clean the wound, and that's the most important part. Making sure there's no dirt or debris inside of the wound wherever people get hurt. I'm putting this in here. My meds. Flashlight. This is a rechargeable one. You don't need a big flashlight. I got a pen light. This is what this is called, a pen light. Pen lights are important for making sure that the eyes are still reactive. So what you're looking for when you flash this into someone's eyes is that you're looking for the pupils to contract, to get smaller. So if the eyes are reacting, that means that's a good thing and that the person's eyes aren't damaged. So I'm going to put this in the front. I'm actually going to put this in the front because that's kind of important. Now let's see if this fits. Wow. Amazing. Okay. Ooh. I don't know what that was. Let me just check. What was that? I don't know what that was. Something popped. Anyway. Okay. So now, personal stuff, I guess. Eraser, pencil, pen, permanent marker. Candy, vitamin C candy. This is Yum Earth. Yum Earth is, if I'm not mistaken, allergy-free. And I got the vitamin C kind, so they're like healthy candy. And this is good for in case anyone has like a glycemic episode, which is if a person with diabetes runs out of sugar in their body, they need a piece of sugar. And because they'll pass out, right? They'll feel faint. They'll nearly pass out. If you give them a piece of candy, it'll give them a little sugar, a little energy boost for them. Basically, is why I'm carrying candy with me. Let me put this hand sanitizer, because I have 2. I'll put this hand sanitizer in the main packet so I know that to use hand sanitizer before I get started on anything. This is a little mirror brush duo. Just gonna put that in there. Lighter. Eye drops. These are Cool Relief Roto. So these are like a little minty. They're like minty for your eyes. Not really the most necessary thing, but they fit inside my bag. So I'm just going to put that in there. My wallet, ID, COVID card, credit cards. Well, debit cards. I don't do credit anymore. So put that in there. This is just sentimental. This is an old Taco Bell packet, so I'm just gonna put that in there. Perfume. I'm not supposed to use perfume. Technically you're not supposed to use perfume because some people may be allergic or sensitive to fragrances. This is just for work or any other event that I might be needing this for. I don't have to put it in, but I just want to see if it fits. Lotion. Also don't really need this. This might, if I'm going to be working with patients, my hands are going to be needing to be clean, but I don't want my hands to be dry enough that they like break or like have cuts or anything on my hands. So I'm going to put this in here. Now let's see if that zips. Oh, almost doesn't. Oh. Almost. Almost. Aha. Amazing. This is really full. I think it's because I have this. This is the extra baby tear-free baby shampoo. So I don't really need that necessarily. A couple things I don't need, but you know. I'm just showing you this fanny pack that I got for $6. And how to take care of yourselves in emergencies. And last but not least, Purell. So yes. Ta-da! I hope you guys stay safe out there if you're going to be protesting. Look out for one another. You never know with everything with ICE. And yeah, you've seen it. I've seen it. So we just need to be careful out there because it's trying to get dangerous. Okay? So look out for yourselves, look out for each other, and be safe. Bye.